Shockwave, low intensity shockwave. Turns out it isn't just for penis owners. It can be used in vulvas. And here's how. So if you've been following my channel, you know I recently talked about Shockwave for penis owners for erectile dysfunction. If you haven't been following my channel, welcome, and go ahead and subscribe so you can keep following along. But anyway, Shockwave for erectile dysfunction. Remember, shockwave, low intensity shockwave, carries directed sound waves through our body, tissue healing, and regenerate new blood vessels. Works great for men who have mild to moderate erectile dysfunction. But turns out it isn't just for penis owners. It can be used in vulvas. And here's how. Low intensity shockwave therapy in 2 different placebo-controlled trials was shown to be beneficial in the treatment of vulvodynia. What is vulvodynia? Vulvodynia is pain or discomfort, typically chronic, associated with the outside of the vagina. Pain and discomfort at the outside of the vagina, what is properly called the vulva. That's what we see on the outside. Pain and discomfort that's chronic there. Now, vulvodynia is really nondescript. It's very general, and there are multiple reasons or causes of vulvodynia. We shouldn't all rush out and sign everybody up who has vulvodynia for shockwave therapy, because it is not necessarily meant to treat all of these causes. But it may have a particular role for patients who have not responded to more conservative treatment that have a specific type of vulvodynia called provoked vestibulodynia. And that basically is when you have pain upon penetration of the vulva, penetration during intercourse, even penetration during a physical exam with a speculum or non-genital body part, okay? These patients may suffer debilitating pain, prohibiting them from being sexually active as they desire to because of the provoked pain that occurs with penetration. And it's in these patients that we are starting to use shockwave and notice improvement. And since low intensity shockwave therapy can be done right in the office with no downtime and minimal risk, this can potentially be life-changing for some patients. Now, the data is still early, and this is not widely available to women, but it'll be interesting to see how this picks up with vulva owners. Remember, the last thing is, if you remember from my last video about shockwave, is that not all things called shockwave, acoustic wave, or sound waves are created equal. You really have to know what you're getting. So buyer beware. It needs to be low intensity shockwave therapy. There are plenty of marketing gimmicks out there that sound like the same thing, but are not. So you could just be getting like a vibratory massage instead of actually getting the proper treatment that is supposed to penetrate the tissues and do what it needs to do. Hope you learned something today. Tell a friend, subscribe, and I'll see you next week for more.